In February, the French Senate launched a study on the side effects of COVID vaccines. The Parliamentary House appointed rapporteurs to prepare hearings in which associations, scientists, and lawyers can testify on the matter. On Wednesday, a few dozen people from different associations were waiting outside the Senate. This Paris resident says despite wanting to obtain more in-depth information about potential side effects, the flow of information from the media is very limited.
It's important for people to know what's happening with side effects. We are not being told the truth. I found more information coming from foreign sources and from France.
Following the vaccine mandates, 80% of French people took the jabs, and those who didn't had to face consequences. Anne-Marie Kahn has been working in a Paris private hospitals for 40 years. She refused to take the vaccine because of potential side effects. Her last month payslip showed €0.
Those who refuse the vaccine are left without salaries, with no right to claim job seekers' allowance. We have no rights to anything. It's like we don't exist anymore in French society.
After the mandate was implemented, some associations which defend people's right to choose were created. The group Free Navigators is one of them. Airplane pilot Guillaume Basquin said he heard rumors of
We heard stories about British Airways, but it seems it's a taboo subject everywhere, so in the end it's like nothing is happening.
He heard rumors of incidents but found no answers. He says flight personnel has to undergo many health tests and revisions to be sure there are no risks to passengers.
90% of flight personnel have been vaccinated after President Macron said we needed a test before flights, so we took the shot and thought we were in good health.
But he says some of his colleagues experienced side effects.
One day I was on a stop and was called to replace a colleague who suddenly suffered phlebitis, a thrombosis. This is very rare and I have never come across such a situation before.
Basquin says he has no proof of any potential harm or negative secondary effect, but the aim of the investigation by the Senate is precisely to address and present these questions to health authorities openly and transparently. David Vives, NTD News, Paris.